Hey guys, Wendy with Mobility. I'm here today with Courtney Hamilton of Rooted Home Services, and Courtney is an occupational therapist and focuses on LSVT Big, on craniosacral fascial technique, also aging in place. So I'm just going to ask some questions real quick. Hi Courtney, thanks for joining us.
Thank you for having me.
So tell me about LSVT Big, what it is. I understand it helps Parkinson's patients, but tell me about it, what it is, and how does it help?
LSVT Big is a very protocol type program that started with Parkinson's patients. It also helps with other movement disorders. It is a 4-week program, a full month long. It consists of 4 consecutive days each of the 4 weeks working with therapy, and then every day, including the days you have therapy, there's homework that the individuals have to partake in. They do it twice a day on the days they do not have therapy, and they do it once a day on the days they do have therapy. And so that consists of structured exercises. It consists of some different carryover tasks, and it consists of big walking. LSVT Big is meant to work on the amplitude of movement. So people with Parkinson's typically have hypokinesia and bradykinesia, which is basically having smaller movements and slower movements. So working on the amplitude, the bigness of movements, is basically trying to recalibrate the brain, recalibrate their sensory system so that they start to perceive what to them feels as big movements is actually normal sized movements again. So big is basically the term that anybody who's trained in the program will use with their clients to get them to work on recalibrating and getting back to those more normal movement patterns.
Okay, so once you start this program and they get into it, is it something that if there needed to be a pause for some reason, so if something happened to them, if they got sick, or then they needed to come back and pick it back up again, is that allowed in there, or would you start completely fresh again?
You would start completely fresh again. So the first week, the first 4 days of therapy is kind of a little bit of a trial period. So we'll kind of do our assessments prior to. A lot of times I will use the person's cell phone or their spouse's cell phone to actually videotape kind of how they're moving that first day. So we kind of have a record of what things look like, how they're moving, how they're walking. And so then at the very end, we'll redo the videos so they can kind of see their progress themselves. But also we just look at kind of the speed of movement, the size of their movements. We'll kind of see how they tolerate and respond to that first week of therapy. If they're doing very well, we continue with the program weeks 2 through 4. If not, sometimes we stop, because it is a very structured, it is a very intense program. With the daily exercises, there's 7 of them. The first 5, you're doing 8 repetitions every time you're doing them. The last 2, you're doing 10 repetitions, trying to build up to doing 20 repetitions of each of them. So it is a very busy program. So for individuals that are more sedentary from the start, it can be a little bit overwhelming to them. It can take a lot out on them. So some individuals find that it is just very exhausting and it's a lot for them. It's hard for them to get through all the homework sometimes and get everything done that they need to, but per the research, per the protocol, continuing it exactly as it's structured is for the maximal benefit. And obviously, the earlier diagnosed you are with your Parkinson's, the more of a response, more positive of a response. People with later Parkinson's, they can still respond. There are adaptations. We can do the exercises in sitting, we can do the exercises in supine, laying down, versus standing up if somebody doesn't feel comfortable doing it or feels unsteady. But it's meant, it can help people at any stages, but again, you're gonna see more benefit to those that are earlier on in their diagnosis.
Okay, so within what type of window? So when they're diagnosed, within a year or 2
so
years? So
usually doctors will kind of diagnose their stage. So usually in stages 1 through 3 is where you see the most benefit. Stages 4 to 5 is when you'll still see some progress, but it may not be quite as an intense of a progress from beginning to end with the program. And so once people finish the program, we encourage them to still continue with the exercises once a day, kind of forever, so to speak. We encourage them to, do exercise with peers. We encourage them to keep moving, to maintain those results. And then we can periodically do kind of tune-ups, basically kind of check in with them, Do we feel like we need so much of a tune-up that we would benefit from the whole program again, or just kind of a check-in, just kind of some reminders, some tips to kind of reinforce what they learned the first go around with the program.
Okay. And does insurance pay for this at all?
Insurance typically does pay for the program. We do usually need an order from a physician, just requesting occupational therapy. Because we need the doctor to sign off on the plan of care. That is usually part of the component for insurance to pay, is that the doctor is on board saying yes, they would benefit, and agree that they need this program.
Okay. So your business is Rooted Home Services. What other services do you offer in Rooted?
So we focus a lot on just aging in place in general. That kind of encompasses a few different things. It encompasses working with caregivers, helping them feel empowered and capable to help with their loved ones, maybe helping them learn how to safely transfer their loved ones, or what they can do around the home to help them. It includes doing home modifications, looking at the environment, what things we can do to adjust the environment to make it safer for the individual. We do a lot of fall prevention, fall recovery. So if somebody were to fall, if you're not injured, how do we safely get up without having to call for help necessarily if you're able to. So we do a lot of that as well, wanting to help people be able to stay in their home as long as they can.
Okay. So Courtney, tell me what started all of this for you. Tell me about why you got into doing this and about Rooted and how it got its starts.
So I got into occupational therapy originally because I really like helping people and I really like learning about the body. So I've always kind of just had a passion in general. And then as far as when I started my career, I really liked working with people, and I started kind of in the hospital setting, working with people. But I realized there wasn't a lot of time, right? I was working in acute care, so just when people kind of have those brief hospital admissions and then they get discharged and they're on their way and I never see them again. So it was nice to kind of introduce them to OT, but then I didn't really get any follow-up. So I really liked the idea of having Rooted and creating my own mobile practice so that I can work with people in their home. I can work with people kind of literally in the moment, in their own life, in their own routines, and having that more immediate impact on their daily routines. Being able to see the response, being able to hear from spouses or children or family members that may be in and out of the home too, and them saying, oh yeah, we noticed such a difference, and just hearing that immediate feedback and how much it's changed not only the individual's life, but then those of the loved ones around them. How meaningful it's been for them to kind of have this support as they're trying to age in place and still be able to have as much of a positive quality of life as they can, has been very rewarding for me, and it makes me want to continue to do it more and more to really help support these people to meet their goals of being able to stay home, not having to go to a facility, not having to be separated from their loved ones.
That's great. That's great. I love that. Thank you.
You're welcome.
And what is your service area?
So we're based in Flowery Branch in Hall County, and we usually go about a 30 to 45 minute radius drive from that area.
Okay. And how do people get in touch with you if they want your services? Does it come through the doctor, or do they call you directly?
So people can call me directly if they don't have an order, and I'm happy to reach out to their doctor and try to request an order. If somebody has a need already and they have an order, they can kind of come to me, but ultimately we need that order for occupational therapy services to evaluate and treat in order for me to initiate the evaluation and kind of build that plan of care.
Okay. And so your website is?
My website is rootedhomeservicesllc.com.
Okay. Perfect.
Yeah.
Well, thank you so much for joining us today. And thank you guys for watching, and we'll see you next time.
Thank you.